During a visit to Mulago National Referral Hospital on Thursday, NTV observed that a number of patients seeking services at the skin and STD clinic were still waiting to see a doctor at 12:30 p.m. Some patients had come from far as Mayuge district, arriving at the facility as early as 7 a.m. Sources told us that only one doctor and one nurse were attending to them, as some of the health workers were on strike. According to the Uganda Medical Association, at Thursday's meeting, the government proposed scrapping of allowances for medical interns and making their upkeep costs their responsibility. To date, medical pre-interns who would have been deployed in April are still waiting, as the government says it has no money. The doctors rejected this proposal, as well as the one to have medical students awarded their degrees after internship. Usually, medical students get their degree after 5 years, but are required to do internship for 1 year before they are fully licensed.
They propose that when you finish, a person finishes medical school, after the 5 long years of medical school, after you graduate, they'll actually hold off your graduation. They'll hold off your award. That was very disturbing, that they are proposing to hold off an award of someone who has won it, that is holding back somebody's degree, so that they can now go for an internship, which the students themselves, or rather the young doctors now, because they are no longer students, that they will pay for that internship and be there.
Other proposals by the government include the refusal to enhance salaries for specialists, citing a lack of budget. The government also proposed scrapping allowances for senior house officers who have been on strike since 1st May due to government's failure to pay their allowances for nearly 6 months. The healthcare workers rejected this proposal, stating that they would choke the pipeline of medical doctors Uganda needs at this time.
That meeting, that they didn't know that the medical officers, special grade or associate consultants are specialists. They were referring to them as junior doctors. They are not junior doctors. These are people who have finished a master's. They are the backbone of our service, specialized services in Uganda. Once you stop off the pipeline of the medical intern and you frustrate that child who is going to study medicine, because when people hear that you're going to have to pay for internship, it will be very hard for those people to choose to go to do medicine. Actually, I've read on many forums now, people are saying, why should we do medicine? It's just a suffering, it's a path to suffering.
Every year, doctors go on strike over issues of salary enhancement and areas. But how best can these issues be resolved?
Over time, we've noticed that government has agreed with doctors on how much they will be paid. What the challenge has been for a bigger part is that we are incapable of finding resources to meet government obligations towards the health workers. So we think at the point where we are in the budget processes that are going on now, this is the perfect time when we should resolve this matter.
Yes, we can look at 6 million as something, but then these doctors do a lot of work. You can imagine, for example, one gynecologist doctor working on like 10 mothers.
Uganda still has a low doctor-to-patient ratio below the World Health Organization standard of 1 doctor to 1,000 people. Experts warn that a huge number of health workers are likely to look for better opportunities abroad if these problems persist, and yet the country needs more specialists.
The question for this country is not about lack of money. The question is actually, what are our priorities as a country? Is health a priority for this government? That is where the question is. And I think it is an area where citizens need to put government to task, to account.
These matters will be discussed in the cabinet and a decision will be taken. Meanwhile, the doctors are set to hold a general assembly to also discuss these issues. Nobat at Kunda, NTV News.